This is Bison Quarry in Chengira Town Council, Wakiso District. The quarry has in its existence provided a livelihood for many locals here. Ibrahim Waswa earns his living here, a job he has done for 12 years now.
We start at about 8 a.m. and stop around 6 p.m. But it is not a must for one to spend that long. It only depends on what you are working towards.
Just like many others here, Waswa noticeably conducts his work without protective gear.
We normally don't go for routine hospital checks. We are reluctant about it.
In 2022, the World Bank noted that 78% of Uganda's labor force lies within the informal sector, contributing about 51% to the national GDP. But by its nature, regulation sometimes becomes difficult. And that is why you'll find people who work in such a place here do not meet the standards for safety while at work. Professor Bruce Chirenga is a lung health expert and director of the Makerere University Lung Institute.
We are seeing the changing epidemiology of chronic lung disease, especially in the clinics, where we are seeing more people who are coming with what we call lung fibrosis. Lung fibrosis is basically a disease where the lungs become fiber, as you hear the word fiber. And as you can imagine, a fiber cannot capture oxygen very well. So the biggest problem with these patients, they will come with extreme tiredness. Basically, they cannot do anything, even moving from here to there. They're already out of breath because the lungs have stiffened and oxygen is not crossing.
At Mulago National Referral Hospital, the Department for Lung Health has more than 10 people who are now bedridden because of inhaling dust.
Because most of this dust, the dangerous thing is silica as a component of dust. And most dust you see is up to 60–70% silica. So that dust damages the lung. And that's why in the olden days, this disease used to be called silicosis. Of course, most of them have been treated for TB several times, thinking it is TB, but it's not TB. You check for the TB bacteria, it is not there. But still people in primary health care centers, they still say, maybe let's give a try of what? Of TB, but they never improve.
Whereas this kind of damage happens over a period of time, people at higher risk include those who work in carpentry workshops, maize milling factories, chemical and cement making plants, artisanal miners, among others. Waswa and colleagues at the Bison Quarry say the protective gear affects their work output, hence ignoring it sometimes.
We can't handle the hammer properly with gloves, but the ladies have to wear them to protect the hands.
Dr. Chirenga says the current regimen of treatments being offered is not good, and a lung transplant would cost you about $60,000, approximately 200 million shillings.
Treatment is double-edged because it is an anti-inflammatory. Because the problem which is happening in lung at cellular level or molecular level is a cascade of inflammation. So when we give these people those treatments, the anti-inflammatories, basically steroids, they will improve within a short time. But as you know, the more you suppress the immunity, you cause other problems. Then now they come in now with the infection. So the treatment is not so good, and of course research is going on to identify better treatments. But the biggest problem we have is the kind of fibrosis we have here is different from what they have in the West, where these drugs are made. Because there, most of the research on lung fibrosis is geared towards what we call idiopathic pulmonary fibrosis, which is a clinical entity. So their drugs are targeting that.
However, the Institute is working towards an expansion project that could have some local solutions in provision of care.
We are going to establish a center for advanced pulmonary intensive care as part of the Lung Institute. We are ambitious putting there a lung transplant theater. Now, it's actually not very difficult, because you can start low. You can, of course, the highest is to give someone 2 lungs, but you could give them 1. You can actually also give them a lobe.
Under the Occupational Safety and Health Act of 2006, you are liable for compensation once it's proven that you contracted an illness while at work. But the experts say many employees are not aware. Later on, do they claim for it?
You can even sue your company, then the investigation is done. How does the investigation, how can the investigation be done? By assessing the working conditions in the workplace.
Research shows that the incidence of silicosis has increased by more than 60% over the last 30 years. Mwesigye, NTV.